eventually the nurses began to get it. See, it's one of his crazy patients, so they'd write, does not require medication. I do a lot of work with drawings also, and that would help me to know. In other words, you say, draw yourself in the operating room, chemotherapy, radiation. For some, it's a gift from God. From others, it's hell. And yeah, if it's hell, you're going to wake up with every side effect and every complication. And as doctors, we're not trained how to communicate. We induce trouble. In other words, we're hypnotic in a negative way. I'm giving you chemotherapy, here are all the side effects. So you go home and have them. Even if you don't get chemotherapy, okay, we can make people's hair fall out by saying, I'm giving you chemotherapy. And obviously the 30%, always have that happen. Mm-hmm. But the other side was even more interesting. I get a phone call from radiation therapists. What is it? We thought the machine was broken because your patient has no side effects of treatment. There's a woman who had a sarcoma of the heart, so the surgery was not a choice. So she's getting intense radiation to her chest. He said, there's nothing, no side effects. So I thought the machine was broken. Then I saw your name in the chart. I realized, no, it's a crazy patient. He said, I went into her and I said, how come you have no side effects? She said, oh, I get out of the way and let it go to my tumor. Okay. To me, that's, again, how powerful our mind is in the sense of what it can accomplish within the body.
Well, what strikes me is they label them crazy.
Yeah. Well, that was sort of an affectionate term at that point, one of Siegel's crazy patients. But they meant that it was teaching them something. Because, see, they then began to send me people who were having side effects that were horrendous that they couldn't explain. So, yes, I had the other extreme. See, a woman comes in, blisters, red. She's had 1 or 2 treatments. I talked to her, and ultimately we realized she'd been in a concentration camp, and that room was the gas chamber. So as soon as she was put in there, boom. See, once we resolved that, then things happen. The other was asking people, see, what are you experiencing? Not your diagnosis, but what are you experiencing? And I always find that the words they answer with are about their life. And that could be confusion, roadblock, draining. I had, for instance, a woman with a urinary tract infection. I said, how would you describe this? She said, it's very draining. Then her eyes lit up. She said, thank you, got up and walked away. Because it was obvious to her that this had something to do with her life. I didn't need to explain that. Another woman, failure. Oh, this is a woman. See, again, why is she sent to me? She has a malignant melanoma of her upper thigh. It's removed. You can't tell she's had an operation, unless she's in a bathing suit. But she's screaming at her plastic surgeon, you've made me ugly. He said, can you talk to her? I don't know what the hell's going on. Fine, send her over. She came in. I said, how would you describe what you're experiencing? Failure. I said, how does failure fit your life? Well, my body's failed me. I said, that's not my question. How does it fit your life? Oh, my parents committed suicide when I was a child. I must have been a failure as a child. See, that changed her life. Now, some people, yes, because what I do is hold up a piece of paper with a big black dot on it and say to people, what have I got in my hand? There are 2 answers.
Piece of paper with a black dot.
Yeah, that's a healthy answer, a piece of paper with a black dot. But most people scream, a black dot. See? And I say, no, it's a piece of paper with the black dot on it. This is your life. If you only focus on the darkness, what are you going to live, see? But on the other hand, what if we put the charcoal under pressure and turned it into a diamond? So people with cancer and other life-threatening illnesses will say it's a gift, blessing, wake-up call, new beginning. Okay? They're rebirthing. Yeah. See, he who seeks to save his life will lose it. You become what everyone else wants, you've lost your life. But he who's willing to lose his life will save it. But what you lose is the untrue self. I mean, it stuns me when you look at the statistics of teenagers. I always say, high school student, that's the worst diagnosis I know. Why? 70% in one study have contemplated suicide, and it's the 4th leading cause of death in 10 to 14-year-olds. See, they don't know how to eliminate what's killing them because they don't feel they have power. Mom and dad say, go study. No, I want to do volunteer work. Go study. The kid committed suicide. Okay? Now, what he could have said to his parents is, screw you. I'm going to go volunteer. So what if I get a B?
Yeah.
Yeah. But they were really telling him his grades were going down, and so to go do this. And I think that's the part that if we give our kids the freedom Because I remember reading again about Joseph Campbell, where he went for 5 years to some cabin, in the woods in New York, I think, and read books. Now, I thought, what parents he must have had. Here's this, bright guy. During the Depression, too, he's not even trying to earn a living, living on a few bucks, a month. But that they didn't go after him and say, what is the matter with you? You either get a job or go to school or do something. You don't sit in a cabin reading books for 5 years. But so I think they are part of why he became who he is, in terms of they're allowing him to do that and giving him his life. And so I think that when we, rebirth ourselves, I call it reparenting. One suicidal young lady said to me, "You're my CD." And I said, "What are you talking about?" She said, "You're my chosen dad." So since then, I adopt people regularly. I really just say to them, if you need a new father, I'll be your father. And it isn't about liking, but it's about loving. See, and then, this is hypnotic too. Somebody comes in your office who is totally self-destructive. They even light a cigarette under a sign that says no smoking. In your waiting room, okay? Oh. So what are they looking for? Continued rejection and abuse. See, the opposite of love is indifference. What's worse, rejection and abuse. And so they have lived this. So if I had said to them, get the hell out of here, I'm not going to be your doctor, they'd say, see, I'm not worth, here's another one who tells me I'm not worth anything. But I would always say, okay, come on in and I'll see you next week. Even though they never did a damn thing I recommended, never filled a prescription, drug addicts, whatever. I'd say, hey, see you next week. And what I learned was 6 months down the road, suddenly they take a bath, come in with clean clothes, and tell me they're starting to look for a job. And I'd realize, it's because I persisted in loving them and listening. Helen Keller taught me that. Deafness is darker by far than blindness. So you want to help people, listen, and then you get credit. That was the wonderful part. I'd say nothing but I always say, you want to be a good therapist? I think Larry LeSean taught me that. He said, learn how to go in 53 ways. So, and I practiced it. We have 5 kids with our kids. See, if they'd come in and say, Dad, I got a problem, and I would tell them what to do, they'd say, help. But if I didn't say a word for half an hour, they would always say, wow, thanks. You've been a big help, because they now heard themselves. It's like the still pond. I know who I am now, and I can go and do what's right for me. And I'd say the same with the patients, that when we're sitting in a group, I don't tell everybody how to, what medicine and how to cure yourself, and I listen so that they know what's right for them. Whether it's eating vegetables. See, because when I said do a drawing, there are people who drew horrible drawings and say, oh yeah, that's my kitchen. I said, why is everybody standing on the head? Because I don't like macrobiotics, and the kids don't eat with us. And he'd rather have an operation than chemotherapy. So I say, fine, go ahead. There are others who see chemotherapy as poison, but draw it as yellow energy flowing right to their cancer. So I'll say, go. You intuitively know. And that's the part that we need to understand at both levels. There's the intellect, and whether you call it the unconscious, intuition, or whatever. They're two very different entities. So your intellect may say, oh, I need to do this, and your unconscious is saying, it's hell. And you've got to get them to agree and make the right choice. Then your body, in a sense, calms down, and you have a very different experience. And this is something, as I say, that I saw over and over again working with people.
Now, Bernie, let me ask a question.
Go ahead.
I sit here and I'm listening to this very enlightened person. Yet your training had to have been very classical.
Yeah.
Which certainly for a surgeon is not enlightening.
Right.
What happened
what's
to you?
interesting,
What happened to you?
I think in a
wrong?
sense that conference, because you just reminded me of something. This was a Friday to Sunday conference at Carl Simonton. After that, yes, I went to do things with Elizabeth Kubler-Ross and others, and she would talk about all these spirits in the room. I'll tell you some more stories. But I came back on Monday to our office, and one of my partners said to me, you're gone. I said, what are you talking about? He said, you're going to leave surgery. You're a totally different person. Now, I said to him, you're nuts. What are you talking about? But he saw a transformation in me based on that weekend. And I'll tell you why, in a sense, too, and some of the mystical things that have happened to me. But it was interesting. Within 10 years, yes, I quit surgery. Now, I think part of it is that I cared, as I said, about people. I can remember talking to Carl Menninger, the psychiatrist, and others, because they had this experience that I was having. I mean, Menninger, as a matter of fact, when I wrote Love, Medicine, and Miracles, I sent a copy to Carl Menninger to make a comment. And he said, I was about to write a book called 12 Hopeless Cases. These are 12 people who should be dead who walk around fine today. He said, but you wrote it, so I'm not going to. And so, again, when I went to work with Elizabeth, I drew a picture for her. Let me jump back first to Carl. Don't let me forget. He said, we're going to do guided imagery. I thought, what the hell is guided imagery? That's nonsense. You know, the surgeon is sitting there. I said, I came to learn things. So I'm just sitting there like this, you know, staring up at him on a platform. And then he looked at me, and I thought, oh, he knows I'm not doing it. I'll close my eyes. I'm an artist, say, and so I'm very visual. And when I closed my eyes, my God, it was incredible what I saw and, you know, who I met. I mean, my inner guide, too. You know, he was saying we're all going to meet an inner guide. And I thought, okay, so Moses, Jesus, I'm a doctor. Let's see who comes. And this fellow named George shows up.
George?
Yeah. And I thought, George, yes. And if you want to put this on, I have a picture of him. That's why I'm going to tell you about it upstairs. When I went to Elizabeth, she said at this conference, because again, it was the pain of how do you deal with death and dying. So she was helping me with that. And she said, Bernie, draw me a picture. So I drew her an outdoor scene, which also I have upstairs. There are 12 trees. There's a mountain with snow on it. My George is sitting next to me, a bird named Rainbow, and a fish jumping out of water. She said, Bernie, what are you covering up? I said, what are you talking about? She said, you put snow on the mountain. I said, yeah, it's snow. She said, Bernie, the page is white. You took a white crayon and added a layer. What are you covering up? Oh, why do you have 12 trees? I've been doing this 12 months. Why rainbow? You know, getting your life in order. Why a fish out of water? That's what I feel like. I mean, I thought, I draw this crazy little outdoor scene thing, and she tells me about my whole life.